The recent outbreak of Mpox, driven by the clade variant, has raised concerns globally, particularly in regions outside of Africa where this new strain has begun to spread. While the World Health Organization, WHO, reassures that Mpox is not the next COVID-19, its emergence as a more contagious variant has prompted increased attention, especially in the wake of the devastating impact of the coronavirus pandemic. The clade variant, responsible for a significant epidemic in the Democratic Republic of Congo, DRC, has now been detected in multiple countries outside of Africa. On Thursday, Thailand confirmed its first Mpox case involving the clade variant, making it the second country outside Africa to report this strain. Sweden was the first non-African country to detect clade, traced back to an individual who had recently traveled to Africa. In Africa alone, over 17,000 cases and 517 deaths have been reported across 13 countries this year, with more than 95% of cases occurring in the DRC. The new clade variant is considered more contagious than previous Mpox strains and has spread to at least 12 African nations, along with regions in Europe and Asia. Mpox, formerly known as monkeypox, was first identified in monkeys in 1958 and is closely related to the smallpox virus. It can be transmitted from animals to humans and between people, primarily through bodily fluids, close physical contact, or contact with contaminated objects. There are two main clades of Mpox. 1. Clade I, generally more severe, with a higher fatality rate, especially among children. 2. Clade II, often leads to milder disease and is less likely to be fatal. The clade variant is a mutation within clade I and has proven to be more transmissible. The Centers for Disease Control and Prevention, CDC, notes that Mpox typically presents with a rash, which can appear on the hands, feet, chest, face, mouth, and around the genital area. The rash may be painful or itchy, with lesions that can become bothersome. Other symptoms are similar to flu-like conditions, including fever, chills, sore throat, congestion, cough, muscle aches, and fatigue. The U.S. faced a significant Mpox outbreak in 2022, with over 32,000 infections and 58 deaths linked to the clade II strain. The clade I variant, including the newer clade IB, has not yet been detected in the country. However, experts warn that it is only a matter of time before international travel brings this more virulent strain to the U.S. Dr. Kyle Enfield, a pulmonary disease expert at the University of Virginia, emphasizes that while Mpox can spread, it does so at a slower rate compared to respiratory diseases like COVID-19 and influenza. The requirement for close skin-to-skin contact or intimate interactions means that Mpox is less likely to cause the same level of widespread transmission seen with airborne viruses. For most people, Mpox symptoms typically resolve within 2 to 4 weeks without requiring specific treatment. Although there is no targeted medication for Mpox, the CDC recommends managing symptoms with over-the-counter remedies and prescription mouthwashes. Importantly, people infected with Mpox should avoid touching or scratching the rash to prevent further complications or spreading the virus. Vaccination is a key preventive measure for at-risk populations. The JYNNEOS vaccine, administered in 2 doses over a 4-week period, has proven to be highly effective at preventing Mpox infection and reducing the severity of symptoms in those who contract the virus. The CDC provides a vaccine finder by zip code on its website to help individuals access the vaccine in their area. As the clade variant continues to spread, global health authorities remain vigilant in monitoring its impact. The WHO's recent declaration of a public health emergency serves as a reminder that emerging infectious diseases can quickly evolve into global threats if not addressed promptly. Enhanced vaccination efforts, rapid detection, and public health strategies are essential to preventing further outbreaks and mitigating the spread of Mpox. For those concerned about exposure or seeking protection, staying informed about vaccine availability and practicing safe behaviors, especially in high-risk groups, are crucial steps in minimizing the risk of infection.